Okay, so raise your hand if you get an amazing night's sleep every night. Rats. I was hoping I could outsource the talk. I'm like, if somebody raises their hand, they're coming up here because we need your secret solution. Because, yeah, we all have, spoiler alert, we all have challenges when it comes to sleep. Okay, I have a kind of bad news, good news slide here. We know that Huntington's is progressive, unfortunately. We know that we, unfortunately, do not yet have an approved disease-modifying therapy, yet being, of course, in bold, because we also know that there is promising research underway, and there's absolutely a reason for hope that we're getting much closer to having an approved disease-modifying therapy. So that's the bad news, if you will. We do, importantly, have effective symptomatic therapies when and if we need them for most of the symptoms of HD, the motor and the non-motor symptoms of HD. Importantly, there are things that we can all do with or without HD, there are things within our control that we can do to make a positive impact on our health. Okay, when I'm in the midst of the madness, and I feel like we're in this world where there's so many things that we can't control, especially if you have HD, it can feel like, oh my gosh, everything is just out of control. I just ask myself, my patients, my family, let's go back to the basics. Let's control the things we can control. There's a lot in this world that we can't control. But if we can just stop and say, okay, what are the things that we can do that are within our power to improve our quality of life? That's a good start. So, what are 3 things that we do every day that we can modify or potentially improve upon? Most of us eat, okay? Most of us move, and most of us, at least should, sleep, okay? So let's talk about ways to improve or optimize on each of these, but we're going to focus mostly on sleep. So some fun facts. You guys know most of these. This is a little sleep 101. We spend approximately 1/3 of our time sleeping. We know that sufficient sleep quality and quantity is really imperative just as imperative as kind of food and water, so it's imperative for us. We know that sleep is restorative, and actually, we don't fully understand why we sleep, by the way. We've learned a great deal about sleep and the mechanisms of sleep, and we're learning more every day. But one of our more recent discoveries, not terribly surprising, is that sleep is restorative. It makes sense, right? In fact, we've recently discovered that there's something called lymphatic clearance. So when we sleep, we are likely removing toxins from our brain and cleaning up our nervous system. So sleep is really important. Some more fun facts about sleep. You guys know probably most of these. Sleep occurs in 5 stages if we include wakefulness, when we're starting to drift off into sleep. Approximately 75% of our night is spent in non-REM stages of sleep. And we go through, ideally, we should go through about 4 to 5 sleep cycles per night, which with each sleep cycle being roughly 90 to 110 minutes. So we start to drift off. We're getting drowsy, hopefully. We're going into light sleep here in stage 2. That's okay. And then here, stage 3 and 4, we get into our deeper stages of sleep. We've historically thought that REM sleep was the most important stage of sleep, but now we know that our deep sleep is really important. Our non-REM deeper stages of sleep are really important, and likely when some of this restorative sleep is occurring. I want to take a minute and just talk about REM sleep, because there is a common disorder that can occur during REM sleep. Have you ever heard of RBD, or REM sleep behavior disorder? Okay, so normally during REM sleep, we're busy. Our eyes are moving, but we have muscle atonia. So we're not moving our limbs, but our eyes are moving, our brain is active. With REM sleep behavior disorder, individuals don't have that muscle atonia, and so they can act out their dreams. REM sleep behavior disorder, which is abbreviated RBD, is actually quite common in individuals with Parkinson's disease. Not as common in Huntington's disease, but it can occur. Sometimes it can be the result of medications. But it's an important, I think, disorder to be aware of, because it can be potentially dangerous, not only for the individual that's acting out their dreams, but as you can imagine, for their bed partner. And so worst case scenario, folks can end up injuring their bed partner or themselves. They fly out of bed. And I found over the years, especially in visiting with my Parkinson's patients, that most of my patients don't readily provide this information. Their spouse doesn't say, my husband's beating me up at night, because they're probably a little embarrassed about it, or they don't realize it's something we should talk about. And I think it's important to be aware of it because there are relatively effective treatments for REM sleep behavior disorder besides large seatbelts, strapping yourself to the bed, which I've heard has happened in the past. That's just a little side note there. We've talked about the stages of sleep and, quote, normal sleep, as if there's anything normal in our world anymore. Now let's focus a little bit on sleep disturbances in HD. Interestingly, sleep is an underrepresented non-motor symptom in HD. There are probably many reasons for that. We know that some individuals with HD have anosognosia, or lack of kind of insight into some of their symptoms, so they may not really recognize that they're having sleep disturbances. But we actually our group wrote a paper, we did a little study, we asked our patients and their care partners some questions to complete some questionnaires, and we found that when we asked, that 90% of individuals with HD reported having some problem with sleep. So it's happening, it just hasn't historically been as representative as we would like, but we're raising awareness and we're making progress. Sleep disturbances in HD can be present years before folks have motor symptoms or significant non-motor symptoms in the, quote, pre-manifest period. Recently, Dr. Nicolas, Ogilvy, and Schultz actually looked at the Enroll database, Enroll HD database, and they found that many sleep disturbances emerged at motor onset when folks started to really have more significant motor symptoms. They also found that sleep disturbances seem to be more common in individuals with juvenile HD, and that interestingly, sleep disturbances seem to increase with disease progression. What are these sleep disorders that some folks with HD may experience? Sleep fragmentation is not uncommon. So that's just frequent awakenings during the night. And we know that as a general rule, chorea, or the most common involuntary movement that occurs in adults with Huntington's disease, should quiet down during deep sleep. But it may be present in the lighter stages of sleep. If I have a patient or their family member telling me my loved one is really active just before bed or when he or she in the middle of the night, it's usually because they're having these frequent awakenings, or just before they go to sleep, the chorea can be more prominent. And then folks can have some increase in anxiety, and then the chorea increases, and then we're pretty active, more active than we'd like at 2 a.m. We know that it's not uncommon for individuals with HD to have a circadian rhythm disturbance. There can be changes in the sleep-wake cycle, which can result in daytime sleepiness, difficulty staying awake and alert during the day, and then often I'll hear from my patients or their loved ones that they're staying up really late, that they're sort of night owls and nocturnal, and then sleeping during the day. And that's make things a little tricky some of the time. Also, we know that delayed sleep latency is common, so getting in bed, getting ready to go to sleep, and then having trouble actually falling asleep is not uncommon in HD. So I've talked about some of the more common sleep disturbances in HD. How do we diagnose sleep disorders in HD? We have something called the UHDRS, the Unified Huntington's Disease Rating Scale, which was published by the Huntington Study Group in 1996, and this is a relatively objective scale that helps us measure the severity of motor symptoms in HD and some of the cognitive symptoms and some functional questionnaires. But interestingly, there are not any questions about sleep in the UHDRS, so that can't help us. There are some scales that we can use, some questions we can ask folks that are for kind of the general population. They're not HD specific, but they can be helpful, and that's actually, we use some of those in our study. There is an HD sleep questionnaire, HD specific sleep questionnaire, that can also be really helpful. It's lengthy, but it can give us some HD specific info. We can ask our patients to go have a sleep study done, and there's our little patient over here. It just really does, I love this, because it cracks me up. When I'm telling my patient, okay, I'm ordering a sleep study, all you have to do, and mind you, I'm ordering a sleep study because you can't sleep. All you have to do is go to this little pseudo hotel/hybrid hotel/hot room. They're going to hook you up and then just go to sleep. It'll be fine. And then they're going to tell us what's wrong. Yes, not terribly realistic, but believe it or not, we often can get quite helpful data with sleep studies. So the fancy name for a sleep study is a polysomnogram, and that's the gold standard when determining whether or not, if in fact someone has a sleep disorder, what's going on, which sleep disorder is it? And then, of course, we can have Folks wear watches. I have a fancy watch that I have abandoned. My husband gave it to me. I just got so tired of waking up in the morning and just getting beaten down by my watch. Terrible night's sleep last night. I'm like, I knew it. And you can take sleep diaries. So there are lots of ways that we can collect data on how folks are sleeping or what the issues might be. But at the end of the day, as I mentioned previously, we just need to start by asking. So we really, as clinicians, we need to incorporate this into our day-to-day practice. And so when we visit with our patients that have HD, we really need to make sure that we're asking the right questions so that we can hopefully help them in the land of sleep. Oh, and this is a little fun fact. So there's HD, which I've mentioned briefly on the previous slide. It's an observational worldwide study. You may have heard about it. You may be participating in it. And they're in the process of revising and Enroll and adding some questionnaires. And there will be a sleep assessment in the newer version of Enroll, which is exciting. That means we're raising awareness about sleep disturbance in HD. This is also, this is not surprising. What happens if we don't get enough sleep? We fall apart at the seams. That's the bottom line. We can get more irritable, which can already be an issue. And some folks with HD, can have trouble with attention, with focus, which can also be part of HD. We can just have slowing of our thought processes and reduced logical thinking. Whenever I'm talking to an individual that is gene positive for HD and they're concerned maybe about their cognition and I'm having trouble with attention and focus, and I know these things can be part of HD, and does this mean I have symptoms consistent with HD? One of the first things we do is we ask our patients about sleep, because we know that if they're sleep deprived and running on fumes in the sleep department, they may have many of these symptoms that may be really indirectly related to their HD. And so we want to make sure that we, like I said, asking the right questions to help treat some of these symptoms. Other side effects of sleep deprivation, it just basically doesn't make our brain happy if we are sleep deprived. We have neuronal dysfunction. We know that the motor functions can even be more pronounced, motor disturbances, I should say, can be more pronounced when folks are sleep deprived, and we can even have some dysregulation of our immune system. So sleep is important. Why do we not sleep? There'll be a quiz at the end, so please pay attention. I know this is a really busy slide. What I want you to focus on is the red font and the bluish font. So these are the kind of non-modifiable areas here. But all of the red font, these are things that, at least in theory, we can modify. We can get back to control the things you can control. But we know in HD and other neurodegenerative diseases that there can be atrophy or degeneration of areas in the brain that are important to help us with sleep. But what are things that we can do to try to turn the beat around? And so I think I'll talk about most of these in a moment. But we know that, I think I'll just say here, that psychiatric symptoms, so anxiety and depression, can disrupt sleep. And so it's important that we are having conversations about how we're feeling to determine if we need to start a medication. And then hopefully that medication doesn't exacerbate that sleep disturbance. Hopefully it helps. I have seen there are some medications, I'm not going to go into detail with medications today, I'll mention a few, but there are some medications that we use to treat anxiety and depression in folks with or without HD. A common class of medications you've probably heard about are the SSRIs, or selective serotonin reuptake inhibitors. It's surprising they're not just in the water supply. Serotonin's not in water supply, but nonetheless, they're not generally thought of as sedating medications per se. In fact, sometimes they can even promote some wakefulness, depending, especially if it's an SNRI. But nonetheless, I've found that if in fact an individual is anxious, if we effectively treat their anxiety, even though the medication that we're using is not sedating, indirectly we can improve sleep. So lots of things that we can do or modify. Nocturia is just basically having to urinate frequently at night, and so that can occur in the general population, it can occur in folks with or without HD. This is why we're all here, right? How can we improve sleep? What is the magic formula? How can we have a good night's sleep? I've already mentioned we might want to address psychiatric symptoms, and if in fact there's some anxiety and or depression or other psychiatric symptoms, let's make sure that we're treating those. There may be some pain, especially if folks are farther along in their HD journey. They may have pain, but they may not be able to really share that with us effectively. So we want to make sure that we're doing our best to determine what is it that's really negatively impacting sleep quality or quantity. Substance abuse, I'll mention in a moment, or Yeah. Sometimes we do need to use medications. There are lots of medications out there. Every medication has potential side effects that they can at times be beneficial. We just want to be respectful of medication side effects. If and when it's possible, we want to avoid non-pharmacologic therapies for sleep disturbances. Let's talk about sleep hygiene. Let's talk about controlling the things we can control. This is a little disclaimer. Do as I say, not as I do. This is me. My kids, whenever I give a talk on sleep, my kids just point and laugh. They're like, really, lady? You're going to give that talk? Okay. Like, you're the one that's staying up on your laptop until how late working? Okay, what can we do? You guys know these things. These are pretty obvious, right? But I'll highlight a couple of those in a few slides. But first things first, try to be as consistent as possible. Really try to go to bed at the same time every night and wake up at the same time every morning. And I'll show you a little study that supports that. We should exercise to the best of our ability, get some physical activity during the day. We should, again, we know these things, maintain a balanced diet and really try not to eat a full heavy meal just before bed. Try to eat your last meal about 4 hours before bed. You can definitely have a snack, a light snack before bedtime, even better if it's tryptophan rich. So think about your warm milk before bed that I'm sure someone has recommended along the way, but you can have a light snack before bed and it may help you with sustaining sleep. Think about relaxation, training methods. There are lots of things out there for better or for worse on the internet. There are some different apps for relaxation and deep breathing. So those are some things to think about, plus cognitive behavioral therapy, which I'll mention in a moment. You want to sleep ideally in a cool, dark room. And what does cool mean? This is always a point of contention in our household. We're like fighting at the thermostat and like sneaking in there after I'm staying up too late, making it even cooler. But it really should be in the kind of mid to low 60s. That's chilly. I know. I love hearing that and saying that. My husband is not. Yeah. But you want your room to be cool and dark. And something that I discovered relatively recently, it's not that novel, are weighted blankets. Those are really cool. If you haven't tried one, I would highly recommend. You can get them at Target. They're not super fancy, but they're lovely. You want your room dark, which sounds obvious, but most of us have something plugged in, charging, and so there could be lights that are trying to creep in and can be disruptive. This is debated, everyone, but nonetheless, you should try to get at least 7 hours of sleep a night, I think is a reasonable recommendation. We know this, yes, we know. No cell phones, no TV, none of this nonsense in your bed right before bed, okay? Really, your bed is for sleeping, only sleeping. That's what the sleep experts say, but try to limit naps. It is okay to take a nap, but if you're going to take a nap, one nap per day, ideally, not longer than an hour, and in the early afternoon. So ideally, a scheduled nap is best. You don't want to, what a lot of folks will find themselves doing is cat naps throughout the day, and then before you know it, your sleep-wake cycle is disrupted, and so that's generally not a good thing. Let's see what time. Okay, yeah, I gotta pick up the pace. Okay, avoid caffeine before bedtime. Yes, we know this. Avoid alcohol. Caffeine and alcohol, really try to avoid those 3 to 4 hours before bedtime at least. And then I just made this up. Consider a sleep contract. Because I'm like, yeah, again, I do as I say, not as I do. We have all these great recommendations, but they're hard. It's hard to implement these things. It's hard to put your laptop down or put your phone down. And so if you can ask your partner, friend, whoever, your family member, maybe to hold you accountable and say, hey, these are the things I'm really going to try to do. And then they can call you out on it, and it'll be lots of fun. Okay, additional tips for proper hygiene. Oh yes, I love this. It's like my life. Okay, this was from a lovely paper that I found with all sorts of recommendations, and this was just a little section on worrying. And don't take your worries to bed. That's easier said than done. But what I liked is that she offered some suggestions. If you are in fact a worrier, try to implement active worrying or scheduled worry time, which is hilarious but awesome, right? Okay, I'm giving myself from 3 to 5 p.m. to worry and panic and get on my hamster wheel, and then I'm just going to put it away, okay? So you write a list of the things that you're worried about, which can be quite therapeutic, and then decide, okay, what can I prioritize, okay? And then we cross some things totally off our worry list and save them or save them for a later day. And then decide on a plan of action. And so think about, okay, what are the things, this is what's stressing me out, what can I do about it? And then we're going to worry about this tomorrow because it's bedtime, okay? I mentioned a sleep-wake cycle, a consistent bedtime, consistent wake time, and the importance of this. Yes, this I also thought was hilarious. I think back to when I had my first son, and people were like, yes, clueless, and yeah, haven't slept since, and he's 20. Okay, so is a consistent sleep schedule beneficial? It makes sense, but actually there was a study done and published just last year by the National Sleep Foundation who gathered a group of experts, they reviewed the literature, and they said, okay, is this really true? This is what we've been telling folks, consistent bedtime, consistent wake time. What does the data tell us? And in fact, they did find that consistency of sleep onset and offset timing is important for health, safety, and performance. So it is really, there's science behind it, not going into the details, but it is beneficial. However, they say, if there's insufficient sleep during the week, then it's okay to catch up during the weekend. Yeah, anyway, sleep is our friend. Okay, just wrapping up here. I mentioned briefly cognitive behavioral therapy. This is cognitive behavioral therapy, or CBT for insomnia, employs a combination of behavioral measures to improve sleep quality, and they're different. They're focusing on stimulus control, sleep restriction, cognitive therapy, relaxation techniques. There actually is some science behind CBTI. Most of it is in folks without HD, but I'll show you on the next slide. There has been a small study done in folks with HD. You can find a psychologist to help you with CBTI. It's easier said than done, but it is something to consider. That is, I would say, that with a favorable side effect profile, kinder than some of the medications out there. Like I said, they haven't had a large study done specifically in HD, but there was a small pilot study done in folks with pre-manifest HD, along with exercise and some social measures that did show an improvement in REM sleep. I think it's something that we should continue to think about and make sure that it's readily available for folks. Just briefly, I've already told you, spoiler alert, no perfect medication for treating sleep disorders. Always weigh the risks and benefits. We've talked about treating mood symptoms. There are some medications that can help with improving sleep. We try not to use medicines only for sleep disturbances, but if we can address, like I mentioned earlier, anxiety or depression, or if we need to address behavioral symptoms, we'll try to pick a medication that can also be sedating if and when it's appropriate to help with sleep. Quickly, melatonin, it's everywhere we turn, in every formulation you can imagine. Is it helpful? Is it not? And the bottom line is we don't really know. There's some evidence in Alzheimer's, which is AD, and Parkinson's. We do have some evidence that folks with HD and other neurodegenerative diseases don't secrete as much melatonin as those without. So we actually did a little study, a tiny little pilot study at good old UT in Huntington. We were funded by the Huntington's Disease Society of America. It was only 20 individuals. It was a crossover design, so everyone that participated acted as their own control. We used exogenous 5 milligrams of melatonin, and unfortunately, the bottom line is there were no statistically significant changes in the primary or secondary outcomes. This is a busy slide. I apologize. I need to make it a little more clear, but nonetheless, we asked the participants lots of questions. We asked them to complete sleep questionnaires. We did not do sleep studies, and so there are lots of reasons that to study potential limitations, if you will, in this study. I think melatonin shouldn't give up quite yet. We need some larger, longer studies but so far, at least our little study did not show that melatonin was beneficial in HD, unfortunately. Exercise, okay, I tell my patients, I laugh every time there's another study, especially in the land of Parkinson's, that comes out. There's a positive study in PD or positive study in HD. Exercise is good for you. Really? Did we really need a study to tell us that? Okay, thank you. Oh, yet another reason to start moving. But the exercise makes our brain happy. There are neurotrophic factors that are released when we're exercising. And so if you're ever feeling like I just can't do it, just remember this slide. It's good for your body. It's good for your brain. Makes your nervous system very happy. And may even be, to some degree, neuromodulatory. So In animal studies and little four-legged creatures in the lab, there's some evidence that maybe, mostly extrapolating from Parkinson's, but in an HD, that exercise may actually slow to some degree progression. If you are just wondering how much exercise you should do, I generally recommend, and me or literature suggests, 150 minutes per week. It doesn't have to be all in one sitting. You could do 15, 20 minutes at a time. Something is better than nothing. Lots of different ways to exercise, even if you're having trouble with mobility, when you're sitting in a chair, moving your limbs. So there are many different ways, shapes and sizes of exercise. And then just finally, diet, and what do we do as far as our diet goes, and how can this potentially positively impact our sleep quality? Just a little plug for the Help for HD cookbook, which is all sorts of awesome. Get a copy if you don't have one yet. Healthy eating, we know these things. We really want to try to have consistent meal times. We want to avoid processed foods, all the stuff that's easy to access, that's inexpensive, and that's unfortunately tastes good sometimes, but you want to try to eat healthy, fresh foods. We do have data in the land of HD and in Parkinson's and other conditions that the Mediterranean diet is our friend, and I think most of us know Mediterranean diet is nuts, fish, olive oil, all this stuff. It really is yummy and wonderful, fresh fruits and vegetables, but sometimes hard to grab on the go, but we're getting there. In summary, sleep disturbances are common in HD, and we think they actually increase as the disease progresses. Why the font's so small, but increased awareness about sleep dysfunction in HD. Yay! I mentioned that now there's sleep assessment and enroll. I think we're really, as a community, recognizing the importance of sleep, not just in the land of HD, but in general for our neuronal health. We can modify our sleep hygiene, our diet, our activity level to hopefully improve our well-being. Just be patient with yourselves. Again, I'm not here telling you all these things that you should do they're hard in reality to implement, but just take it one day at a time. Start small. Set small goals. 10 minutes on the treadmill is better than 0 minutes or on the Peloton. So just walk around the block or walk around the house. It's better than nothing. Thanks to Help for HD for empowering us through education. And most importantly, thank you to all my patients and families that inspire our entire team every day. So thank you for listening.